Okay, hello YouTube. I hope you are doing great today. So today we will be looking again at some questions. We will be looking at some questions of MRCP and how we're gonna answer them. Okay, let me synchronize my Anki tests. Okay, so as I mentioned in my previous video, what we're gonna do is answer some of the questions. We can answer some past test questions. We can answer PassMedicine question, USMLEs, BMJ, whatever you want. Just let me know in the comment section. So first, I think I'm behind in my past test questions. What I've done, as I mentioned in my previous video, I've done a custom field for the average, for the easy and the difficult questions. I'm gonna go first for the average questions, and this includes all sections that has been um, randomly selected from. Okay, so the first question here, it seems that I've gone through before because it's highlighted. It's a revision. So it's a 42-year-old with a rash that has developed over his arms in the past 2 weeks. Okay, so it's a rash over 2 weeks. History included hypertension, takes lisinopril, bendraflumetazide, suffers from manic depression, psychotic episodes, chlorpromazine for 6 years, reviewed by his psychiatric 6 months, started on lithium, complaining of indigestion, GB started him with lansoprazole, the rash described later as a scaly rash. So this is the main point here. So it's a scaly rash, so it's more of a psoriatic rash on the extensive surfaces. So which one is likely to do or trigger psoriasis? So we know NSAIDs can trigger them, sulfonamides can trigger them, lithium can trigger them. Okay, so is that correct? Let's have a look. Yes, that's correct. And we've looked at it before. So the rash is psoriasis precipitated by lithium, and those which exacerbate psoriasis include lithium, antimalarials, NSAIDs, and beta blockers. So it seems this is a common question. Okay, let's look how much got it. So we can see that 50% only got it right, which is weird. So 50% got it right, and people has been getting it wrong for some reason. People are answering chlorpromazine and bendraflumetazide. To be honest, I have answered bendraflumetazide before as well. Okay, so we've got this question done. So now it's an easy question for us. Okay, it's from therapeutics section. So I'm gonna go for good and then go for the next question. Okay, this is a long question. Now you have to be able to read through the keywords quickly. Now the good thing about PasTest, they highlighted the clues for us anyway, so we can go through the clues if you wish quickly. It's better if you look at what they want from us. So what is the most likely causative elicitive drug? Okay, so this is a 22-year-old university student brought into the emergency department, has tonic-clonic seizures at a nightclub, acting strangely beforehand. So it's an illicit drug use. Suspected has been given drugs. He's diffusely hypertonic, hyperreflexic. Blood pressure is high. Heart rate is high. Respiratory rate is high, temperature is high, AVP is P, investigations, hemoglobin is okay, sodium is low, so it's hyponatremic. Something losing sodium, phosphate is okay, bicarb is okay, calcium is okay, Slightly on the lower side actually. Creatinine is okay, urea is okay, urea also on the lower side. CT, no evidence of intracranial bleed. No evidence of intracranial bleed or raised intracranial pressure. Okay, so it's not something intracranially, it's one of the drugs. Quickly looking, either it is amphetamine or MDMA. Let's look through the rest of the question. Okay, tonic seizures at the nightclub, acting strangely beforehand, then collapsed on the floor, shaking violently while demonstrating urine incontinence. Did he have a seizure? Appear to have sustained no injuries in the fall. Okay, so that explains why there is no bleed. His friends explained that at the club he was seen speaking with someone they have never met an hour before becoming unwell. Okay, and the suspect has been given drugs. The examination reveals that his pupils are equivalent at 5 mm diameter and reactive. So why this is important? This is important because if it is a opioid, then it's going to be pinpoint pupils, isn't it? So if it's cocaine, heroin, neither of those. If it is marijuana, I think it leads to dilation, cocaine dilation, heroin, pinpoint pupils. Let's continue. Blood sugar is fine. Aroused, is confused, disorientated, unable to localize to pain, eyes open to command. I3. He is unable to follow commands and drifts out of consciousness rapidly. Diffusely hypertonic, hyperreflexia, muscles of his arms and legs are tightly rigid, no focal neurological abnormality, blood pressure is high. I think it's amphetamine, but I'm not sure if amphetamine causes rigidity in the muscles. I'm gonna go for amphetamine, even though MDMA could be another. That's my fear, MDMA. So MDMA is the ecstasy drugs, frequent drug of abuse is hallucinogenic drug. This results into initial rush. Blood can present with hypothermia, delusional hyponatremia. That's what we can see. So the hyponatremia is explained here as delusional. Delusional. Okay, exacerbated by increase in the antidiuretic hormone. And large volume water intakes among users. Hyponatremia is an important cause of MDMA-related deaths and present with a fatal seizure. Okay, so hypothermia, hyponatremia leads to death, fatal seizures. In this case, the patient is currently post-ictal from likely MDMA intoxication, require intensive care support, likely require high concentration saline replacement. Okay, so why is not amphetamine? Amphetamine misuse is associated with tachycardia, okay, hypertension, okay, hypothermia, okay, tachypnea, okay, seizures, okay, but that's the main point. It is rarely associated with significant delusional hyponatremia, as is demonstrated in this case. So that's how they get you in the question. So both MDMA and amphetamine are valid answers for all symptoms apart from the hyponatremia, and you could miss that easily. Now, 55 questions, 55 people answered it correctly, and 25% got the wrong answer, like us. Okay, that's no problem. So this is one question we got it wrong. Okay, we still have two more questions to check if we are able to answer it or not. Okay, that's fine. So this is a hard question. I'm gonna classify.